este otro que está teniendo conmigo. Hola, muy buenas tardes a todos. Gracias por acompañarnos. Estamos aquí en vivo y en directo desde nuestra ciudad capital, Hartford, en el número 75 de la NIños, en lo que se llama el Concilio Hispano de la Salud. Me dice que nos está escuchando. Ya, ahora sí. Ahí estamos bien. Okay. Mucha gente ya conectada. Leonardo Goizueta, muy buenas tardes para ti. Lorena Estudián, Micheli Reynoso. Buenas tardes a todos. Me están diciendo que sí se escucha perfecto, sí se escucha. Hay algo muy importante de lo que va a suceder hoy aquí en el Concilio Hispano de la Salud, que es el lugar donde muchas de las familias hispanas se concentran. Hoy vamos a hablar de algo tan importante como es la comunidad hispana vacunando a los niños que están entre las edades de 5 y 11 años. Tenemos a varias autoridades que están invitadas a esta conferencia de prensa, el senador Richard Blumenthal, también el senador Chris Murphy y también el alcalde Luke Ronnie, también Len Varela, quien es el director ejecutivo, también el doctor Juan Salazar, quien es el director ejecutivo y jefe médico del Children's Hospital, del Hospital de los Niños, como le llamamos, y obviamente las personas que están invitadas de la manera más necesaria, porque son las autoridades las que están necesitando saber cómo es que nuestra gente, cómo es que nuestros padres de familia se están sintiendo con respecto a las vacunas con los niños. Es algo que es bien importante. Muchas familias están de acuerdo, estaban esperando ansiosos que este día llegara, pero también hay muchos otros padres que tienen dudas aún, que aún no han podido de pronto dar el paso y dar el sí para que los más pequeñitos de la casa puedan tener la protección de la vacuna del COVID-19. Ahorita ya en unos minuticos va a empezar la rueda de prensa donde todas las autoridades van a conversar, van a hablar, van a también a responder preguntas porque también hay líderes de organizaciones comunitarias que están invitados y que afortunadamente pues hoy van a tener la oportunidad de hablar con las autoridades. Si usted necesita saber un poquito más sobre las vacunas, ¿a quién usted acude? A los especialistas, a las fuentes que tienen toda la información. Pues eso es lo que estamos haciendo hoy aquí desde el Concilio Hispano de la Salud. También les quería contar que ya hay muchas clínicas de vacunación que ya están adaptadas para que los más pequeñitos de la casa puedan tener la vacuna. Por ejemplo, en East Hartford, el Departamento de Salud se ha asociado con Griffin Health para realizar 2 clínicas de vacunación COVID para niños de 5 a 11 años y se va a llevar a cabo en la Raymond Library en el 840 de la Main Street, en la sala de reuniones número 1. Nosotros vamos a postear toda esta información en nuestra página en Facebook para que usted lo tenga. La primera clínica es el sábado 13 de noviembre de 11 de la mañana a 2 de la tarde. También, si bien se van a aceptar las visitas sin cita previa, se recomienda a los residentes que se comuniquen con el Departamento de Salud de East Hartford. Yo más adelante también se los voy a colocar, pero si usted tiene papel y lápiz, apunte. 860-291-7324 para reservar un lugar o al menos estar seguros de que sí están allá. También en el Centro Médico Infantil de Connecticut también está llevando a cabo en el Dunkin' Donuts Park en la ciudad de Hartford. Ustedes saben, nuestro estadio de béisbol que va a albergar 2 clínicas en asocio también con el Connecticut Children's Medical Center. La primera tendrá lugar el 14 de noviembre y la otra el 5 de diciembre. Ambas van a comenzar a las 10 de la mañana y van hasta las 4 de la tarde. Recuerden, 14 de noviembre y 5 de diciembre. Hay estacionamiento gratuito disponible al otro lado de la calle en el 1215 de la Main Street. Todo eso se los vamos a compartir, pero obviamente que se los quería contar. También si usted, por ejemplo, necesita saber más sobre esas del Dunkin' Donuts Park, llame al 860-757-4830. Ya están aquí casi listos todas las autoridades y los funcionarios que se dieron la cita hoy aquí para hablar sobre las vacunas y también dar como un parte de tranquilidad a los padres de familia que están un poquito indecisos y que tienen preocupaciones normales porque simplemente algunas sobre todo la vacuna de Pfizer, en algunos niños, de pronto en los adolescentes que dio ese efecto secundario de la miocarditis, pero ahorita estuvimos inclusive conversando fuera de cámara con el doctor Salazar, quien es el jefe médico del Children's Medical de los niños, y él nos dijo, no hay nada de qué preocuparse, los efectos secundarios son los mismos de la vacuna en los adolescentes y en los mayores, que el brazo les duela, que les dé un poquito de fiebre, inclusive están diciendo los expertos que no hay necesidad de darles ni Tylenol, ni Motrin, ni nada de eso antes de la vacuna, más bien si después hay algún efecto de estos, pues también dárselos. ¿Qué pasó? ¿Qué me están diciendo acá? Gente muy querida, gente que está muy feliz. Ustedes no se imaginan la gente como está de contenta. ¿De qué? Aquí, claro que... Sí, lo que pasa es que me está diciendo acá el señor productor que entrevista a toda la gente. Están aquí ahorita ellos, entre todos ellos, conversando. Pero le voy a volver a repetir quiénes son los que nos van a acompañar en esta rueda de prensa. Está el senador Richard Blumenthal, también está el senador Chris Murphy, el alcalde Luke Bruning, que ya llegó también, el doctor Juan Salazar, quien es el jefe y director ejecutivo también del Children's Connecticut Medical Center, y también está Kenneth Varela, quien es el director ejecutivo del Hispanic Health Council, de aquí de este centro donde nos encontramos, que es un centro maravilloso, donde nuestra comunidad hispana pues está como siempre allí. El alcalde Luke Bruning acaba de llegar también, como podemos ver allí, ahí están todos ellos. Ok, vamos a escuchar lo que tienen que decir las autoridades en estos momentos. Comienza ya la rueda de prensa.
At Charter Oak. Yeah. Very briefly.
Good to see you again. So you're kicking us off.
I'm going to kick this off.
Dick, me, and then Dr. Salazar.
Yes.
Great.
Aquí ya estamos viendo en estos momentos, se prepara para hablar.
Yeah, you tell me what. I'm good.
el señor Kenneth Varela, quien es el director ejecutivo del Hispanic Health Council.
Go. Good morning. I'm Ken Barella, the CEO of the Hispanic Health Council. Senator Blumenthal, Senator Murphy, Mayor Bronin, the staff and myself, we want to extend a warm welcome. Before we get started, I want to recognize our COVID-19 community health workers who are literally on the front line reaching out to thousands of individuals through community events, vaccination clinics, public service media campaigns, and face-to-face conversations. Their commitment to social justice and the health and welfare of our community is demonstrated by their willingness to educate and interface with those most at risk of COVID-19 infection. Can we please give them a round of applause? They're right in the back.
Estamos escuchando al señor Kenneth Varela, con quien también está pidiendo un aplauso.
With the
a toda la
approval of
comunidad.
COVID-19 vaccines for children ages 5 to 11 years old, we have an opportunity to protect our most vulnerable citizens, protect the community, and take one more step towards the exit door of this pandemic. Although this pandemic has disproportionately impacted people of color, we are now to the point where we need to get out of our respective corners and as a nation fight our way out of this public health disaster. As a reminder, to date, throughout the United States, 46.3 million people have been infected and 752,000 have died from COVID-19. As a frame of reference, 675,000 people died from the 1918 influenza pandemic. Without current technology, the ability to communicate on a massive scale, and the vaccine, the current pandemic would have been disproportionately worse. We are encouraging all of you to please consider vaccinating your children, given the CDC and US FDA's approval of the Pfizer vaccine for children ages 5 to 11. All of us love our children, and as responsible parents, you should be questioning any type of treatment your children are being subjected to. That being said, reach out to your physician or other professionals who can speak to the vaccine's safety and efficacy. Their only agenda is to provide you with the facts. On a side note, I want to strongly encourage Senators Blumenthal and Senator Murphy to continue doing your best to get the infrastructure and build back better bills passed. We are edging to a tipping point where our citizens, especially impoverished people of color, are put at significant risk both physically and socially. Moving beyond this tipping point will undoubtedly result in a fractured society and a less optimistic future. Please put this into perspective. The citizens of this nation are only asking for the basics: road, bridges, transit, broadband, airports, childcare, affordable health care, affordable housing. And that we feel safe if we are to grow as individuals and as a nation. Senators, thank you for recognizing this in your efforts to make this bill passed. I would now like to introduce a person I am proud to have as our community leader, Mayor Bronin.
Thank you again to the Hispanic Health Council and to all of the team members here at the Hispanic Health Council. This organization has been a critical partner throughout this pandemic. So many of our community outreach workers have come out of this Hispanic Health Council and are out there doing the work of sharing information, spreading the word, answering questions, and keeping our community safe. And so grateful to everybody here. As we are also grateful to the many, many partners throughout the city and throughout the state who have been doing
work
that
of
work,
reaching out family by family, door by door, call by call, to answer questions and make sure everybody knows that these vaccines are safe and effective. And we're here today because as of this week, children 5 to 11 are eligible for this vaccine. That is a game changer. I am a parent of 3 kids, 12, 10, and 8. 2 of my kids could not get vaccinated until this week. They are so excited to get that vaccine, and I am so relieved as a parent that they will now have that protection and have that peace of mind. And I know there are so many other families that feel that way, but there are also many families who may still have questions. And that's why it's so important that organizations like the Hispanic Health Council, partners like Connecticut Children's Medical Center, and everybody who is able in any way to spread the word, spreads the word that these vaccines are important, they're safe, and they work. I want to share a couple of quick things. First of all, it is always an honor to be with our United States senators. One of the big reasons, I should say the reason, that the team here at Hispanic Health Council and so much of the other outreach work that's been done is possible is because of the resources that Senator Blumenthal, Senator Murphy, Congressman Larson, and our federal delegation fought so hard for. Those dollars are being put to use every day to try to keep our community safe, and we're so incredibly grateful for their leadership and their tireless work for our city and for our state. I also just want to share some specifics about how you can get the vaccine for your kids. You may have heard that next weekend at Yard Goats Stadium, Dunkin' Donuts Park, Connecticut Children's is going to be vaccinating kids 5 to 11 at the ballpark. It's a partnership between the city, Connecticut Children's, St. Francis, and we're incredibly grateful for that. That's an opportunity on a large scale to get a lot of kids vaccinated. So spread the word and feel free to show up there or schedule an appointment. But I'll tell you, my 2 kids who are not yet vaccinated are going to get vaccinated tomorrow because there's a clinic over on Broad Street, 1460 Broad Street, at the Craig Montessori Magnet from 10 a.m. to 2 p.m. You don't need an appointment. Just show up. There's going to be many, many opportunities to get that vaccine, but do not wait. Do it now. And the message that we really want to spread today, which I'm so grateful to our senators for highlighting, is that every child deserves that protection. Every child deserves that peace of mind. In this pandemic, we have seen many disparities laid bare, and there is still a large gap in vaccination rates between communities. And here in Hartford, we've still got a long way to go. But our kids need to be able to stay in school. They need to be able to stay in school safely. They need to be able to travel to visit family over the holidays and not worry about getting sick or getting their loved ones sick. So please, if you're a parent, let your kid have that protection and have that peace of mind, and do it as soon as possible. And finally, on that last point, I know there are a lot of families that travel home for the holidays, and from Hartford, we've got a lot of families who may even be traveling overseas for the holidays, overseas where in many places the vaccination rate is not all that high. So all the more important to act now to protect your entire family. Get vaccinated, let your kids get vaccinated, help keep our community safe, keep your loved ones safe. There are folks in this small room that we're in who have lost very close family members to this pandemic. Protect your family. Now again, with deep gratitude to all of our partners, and especially to our United States senators for being incredible partners and advocates throughout this pandemic. It's a privilege to turn this over to our senior senator, Senator Blumenthal.
Ahora pasa a hablar el senador Richard Blumenthal, quien también junto a todos los demás.
Thank you very much, Mayor Bronin, for those very powerful words and for your leadership continually during this pandemic. And thanks to the Hispanic Health Council, to you, Ken, and to all of the team. I was so glad to be talking to you earlier. I know that the outreach you're doing is in schools and festivals and everywhere that you can reach people, you go to where they are. And that's what we need, to reach people so that they understand what is at stake here. And yes, with the holidays coming, you want not only the peace of mind, but also the health protection for your children, but also for their parents and grandparents and relatives who will be hit by this disease if our children are unprotected. We are all at risk until we are all safe. And this virus will continue mutating, producing variants that may eventually successfully resist the vaccine as long as we fail to stop it. So the holidays provide a special opportunity and obligation as people travel, but also as they just visit relatives in the same town. The blunt fact is that there are wide disparities. Hispanics have been vaccinated in Connecticut at the rate of about 49%, 2 shots. African Americans, about 55%. Whites, 65%. These disparities are unacceptable. That's why you are working so hard to make sure that everyone gets a vaccine. These disparities cannot be allowed to continue, and they will affect our children as well as their parents unless we do the outreach that's necessary. There are about 200,000 total children between the ages of 5 and 11 in the state of Connecticut. 200,000 children who must be vaccinated. That age of 5
El
to
senador Richard
11
le está diciendo que hay 200,000
has
niños que
been
necesitan
proven
ser
safe for
vacunados
this vaccine.
aquí
The
en nuestro
FDA
estado y está
has
instando y
literally
motivando
tested more
para que
than
los padres de familia se
3,000
sientan
children.
tranquilos y seguros con la
Pfizer
vacuna
tested
COVID-19.
separately 3,000 children. The rate of protection is 91%. This vaccine is as effective or more so for children 5 to 11 than it is for adults. And it is equally safe. Even if you have doubts about yourself, please, for the sake of your children, make sure that they are vaccinated, just as you would measles or tetanus or any other vaccine. This one is equally safe. So we've been through a lot of hardship, a lot of heartbreak. And we need to make sure that these unacceptable disparities in health care are eliminated. The simple fact is that a lot of the vulnerability is based on chronic conditions, diabetes, obesity, other problems that are part of a larger health disparity in our country. But on this one, we have the opportunity to eliminate inequities and inequalities in healthcare that will save lives. There were 25 deaths in Connecticut just this past week. Every death, every illness is preventable. It is preventable now through the vaccine.
Dice que esta semana
There is no reason
25 personas han
to
muerto
avoid
a
it.
causa del COVID-19
So,
y que
let
se
me
puede
just
prevenir
say,
estas
everyone
muertes,
como comunidad,
incluyendo también a los niños.
debemos vacunarnos para proteger nuestras familias y niños. Juntos podemos hacerlo. Gracias a todos. Thank you.
Y en palabras en español, dice que juntos podemos hacerlo todos y que debemos vacunar a todos nuestros niños de nuestra
I'm pleased
comunidad.
now to introduce my great colleague, Senator Murphy. We've been working together on the Build Back Better bill, which hopefully will be passing today.
Ahora va a hablar
It
el
will
senador
be
Chris
historic.
Murphy, quien está también
And
trabajando junto
both
con
of
todos los
us
demás
have
líderes
worked very hard
para que
to
toda
make
la
it
comunidad,
possible.
tanto de color también como la comunidad
And
hispana,
the bill will be coming
sean
to the Senate
vacunados.
after it passes the House. We're looking forward to working on it and making sure it passes there too. Senator Murphy.
Recordemos que los senadores son los
Thank
que
you
nos
very much,
representan allá en
Dick. Thank
Washington.
you all for being here
Senador
today.
Chris Murphy.
Thank you to the mayor for hosting us here. Ken, thanks to you and your team for the amazing work that you do. Let me just spend a bit more time thanking our frontline healthcare workers, our community healthcare workers. Particularly before there was a vaccination, you put your health and your family's health on the line to serve this state, to make sure that we got out ahead of this virus, especially when it hit us hard before it hit other parts of the country. I don't think there are any words that we can come up with to tell you how thankful we are to you, Ken, to your team, and to all of the other community healthcare workers in this state who helped Connecticut show the way. We got hit really big by this virus as it spread out of New York, but we very quickly became one of the lowest spread states in the nation. We remain one of the lowest spread states in the nation today because of the great work that you all are doing. So we're here today to talk about the importance of getting everyone vaccinated in every zip code, in every neighborhood. This is my neighborhood. I live just a block away. And so I am particularly interested in the work that we're going to do to make sure that the south end of Hartford has everything it needs to be vaccinated. Like Luke, I have one child under the age of 12, and I beat you to it by one day. He is actually in a car with his mom on his way to Norwich to get his vaccine right now. So we found an appointment for 12:45 today, and by the end of the day, he'll be on his way to being fully vaccinated. But we have really seen this as a partnership. The federal government has put $40 million into vaccine efforts here in Connecticut. That's the direct money that's gone to vaccine efforts. We have sent hundreds of millions of dollars to municipalities and to the state to make sure that everyone has access to vaccines across the state. And we will continue to provide whatever it takes to make sure that everyone has access to vaccines. This has been a big week. Not only have we been able to extend vaccines to 5 to 11-year-olds, but we also got news that there's a treatment coming that may be transformative for people that have COVID. Pfizer's announced that it has a pill, an antiviral pill, that could be 90% effective in preventing hospitalization for those that have breakthrough infections or those that aren't vaccinated. You're beginning to see the tools that we're going to use to turn the corner, to get back to normal life, to be able to take off these masks, to get back to filling our restaurants and our concert halls confidently. But everybody has a role to play here. Everybody has a role to play here. And so we're doing the job of making sure that organizations like the council have the funds that they need.
En vivo y
But
directo desde la
we
ciudad
need
capital
everyone
Hartford.
in this state
En el
spread the
175
word
de
about
Street,
how effective this
desde el
vaccine
Concilio
is,
Hispano de
how
la Salud en estos
safe
momentos
this
está
vaccine
hablando
is,
el
and to
senador
push
Chris
back
Murphy,
against the
quien ha hecho mucho
misinformation
hincapié
that's out
en
there.
que es necesario
I'm going to
que
be honest
todos
with you, there's
estemos
data
en la
out
misma
there showing
página con respecto a las
that
vacunas, sobre todo ahora
right now our
nuestros
social media
niños.
companies are doing a much
También
better job
está hablando de la importancia de
flagging
que
and
nos
taking
unamos
down
como comunidad
misinformation
para
on
poder
English language
alcanzar
websites
esa
than they are on
inmunidad
Spanish
colectiva.
language websites. There's a lot of
Ya habló el
misinformation out there
alcalde
on
de
Spanish
Luquelón, el
language
senador
websites.
Regimental.
And so we
También
have to
habló el
make sure
director
that we get people
ejecutivo
access to the vaccine, but
del
also good
Hispanic Health
information.
Council y
Don't get your information from a
Kenneth
Facebook
Varela, y
page
falta aún
unless it's
el
connected
doctor
to a
Juan Salazar,
hospital
quien es el jefe
or a
médico del
healthcare
Connecticut Children's.
provider or a government agency. Make sure that when you're consuming information on COVID and vaccines and mask wearing, that you're getting that information from credible, reliable sources. So we can all spread the word about the vaccine and we can all make sure that people are relying on the right information when they're making choices for their families. You can go to the resources that have been listed by the mayor. You can also go to the state of Connecticut website. That's how we signed our sign up this morning. We went to ct.gov. Right at the top of the website is a link to sign up for a vaccine. You can sign up or you can show up at one of these walk-in clinics. It's really easy to get that vaccine. And finally, before turning it over to Dr. Salazar, and I'm so grateful to Connecticut Children's for the leading role they've played in getting our kids treated and vaccinated. I want to speak to the challenge that Ken laid down. The disparity that exists when it comes to vaccination rates between our Hispanic population, our Black population, and our white population doesn't exist in a vacuum, right? It sits next to disparities on access to housing, on access to fair wages, on access to jobs. The Build Back Better bill is an attempt to try to
dejar a un
address
lado las desigualdades
these
entre la
lingering,
comunidad negra, la comunidad
unconscionable
latina y la comunidad
disparities
blanca.
that exist
En
right
cuanto a la
now in
vacuna,
our
aquí no
economy.
hay
Make sure that
diferencia
every
social,
kid in this country
ni de
has access
comunidad,
to
ni de
preschool.
etnia. Aquí
To make
todos estamos
sure that nobody
en
in the
un
city of
solo
Hartford
paquete
is
para
out of the
poder
workforce because they can't
proteger a
afford
nuestros hijos y a
childcare
nuestras
for
familias.
their kids. The economic crisis that is sitting on top of Hispanic families in the south end of Hartford explains the disparity that exists today when it comes to vaccination rates. My wife is able to bring my son to a vaccine appointment today because she's got a job that's flexible enough that allows her to take 2 hours to go and get that vaccine appointment. That's not life for everybody in Hartford, Connecticut. That's not life for people that are working 2 or 3 jobs. And so addressing that economic challenge, that economic crisis that exists for so many families is part and parcel of what's going to help us address these disparities in our healthcare system as well. And that's why I love working with children's, because they get that. They get the need to wrap holistic services around kids. And so let me turn it over to my great friend, Dr. Salazar.
Ahora va a hablar el doctor Juan Salazar, quien es el director médico del Connecticut Children's Medical Center.
Thank you, Senator. And Ken, thank you for inviting me. I think my mother would be proud that I'm sitting here with the mayor and our 2 senators. So, Mom, wherever you are, tell me to listen to this. Really proud to be here. And yesterday, actually, it was Wednesday morning, I woke up and it felt great. Why? Because this vaccine is now available for 5 and 11-year-olds. We have been battling with this since February, March of 2020. You all remember that very clearly. It's been very tough, very difficult. It's been very difficult for our kids, the teenagers, the younger kids, whose life has been turned upside down. They can't go to play dates. They can't go to their games. They can't get together. Christmas, Hanukkah, New Year's are coming up. Los Reyes Magos, all these things that we normally do, and they can't do it anymore, or they couldn't do it anymore. Having a vaccine available now that
Doctor
is
Salazar está haciendo
effective and
énfasis
safe for
en
5 and
que ya vienen las
11-year-olds,
Navidades
it's
y a
a
todos nos
dream come
gusta
true for me.
disfrutar
And
en
this is
familia
because of the support
y
of the
la
federal government that
importancia de
allowed
que ya
these
tenemos
vaccines
una
to be
vacuna
developed
también disponible para los
safely and
más pequeños de la
effectively. And I
casa.
feel very confident to recommend these vaccines for the kids that are 5 and 11 years old. Voy a cambiar al español para hablarles a toda la
Ahora nos va a
comunidad.
hablar en español.
El miércoles me levanté por la mañana muy contento. ¿Por qué? Porque la vacuna para COVID para los niños de 5 a 11 años había sido aprobada finalmente por la Food and Drug Administration, el CDC. ¡Qué maravilla! Es una nota de optimismo para las familias y para los niños, para que esos niños puedan volver a reunirse, a juntarse con sus amigos, para ir a la fiesta de Navidad, a la fiesta de Año Nuevo, a la fiesta de los Reyes, que no han podido hacer hasta este momento. Entonces, la vacuna para mí es algo de optimismo, es un regalo realmente que no teníamos. So we have this gift that we need to use. But there's a lot of misinformation, and I get a lot of calls. Why should I give this vaccine to my 5 to 11-year-olds if you're telling us that this virus is not a problem for 5 to 11-year-olds? Well, let me give you some numbers. Throughout the pandemic, 2 million kids throughout the U.S., 5 to 11 years
Durante la
old,
pandemia,
have
2
been
millones de
infected with
niños ya han
COVID-19.
sido afectados
2
porque
million
muchos
kids.
padres le han preguntado
Of
que
those,
por qué los niños tienen que
38,000 have
vacunarse.
been hospitalized.
Pues
Some
es
very sick. We had one
una
2
realidad.
days ago
Los
at
niños
Connecticut
sí se han
Children's was
infectado
in the
con el
intensive care
COVID-19.
unit, intubated because of COVID-19, not yet vaccinated. Did not have the chance to get vaccinated because the vaccine had not been available. That is terrible. 92 kids, 5 to 11, have died in the U.S. 92. Now, some people may say, well, that's not that many. If you're a parent, that's your child, think about it. Think what it means. And if you can use something that can prevent that death, prevent the hospitalization, why would you not do it? You prevent them from going outside in the middle of lightning. You prevent them going across the street of their cars coming through. You don't want that to happen. You put a seatbelt on them, although those events are rare, because you protect them. You protect them for everything. En español, nuevamente lo que quería decirles es de que los padres me llaman y me dicen, ¿para qué poner esta vacuna? Si usted nos dice que esta enfermedad no es seria en los niños de 5 a 11 años, pues la realidad es de que 2 millones de niños han sido infectados con este virus en los Estados Unidos de 5 a 11 años. De esos, 38,000 niños fueron hospitalizados y 92 se murieron de COVID-19. Yo los conozco a los padres, los conozco a ustedes, vienen a mi consulta y ninguno de ustedes quiere que su hijo sea hospitalizado y sin duda alguna ninguno quiere que su niño pueda fallecer por esta enfermedad. Y hoy en día tenemos un arma contra esa enfermedad, tenemos un arma contra la hospitalización, tenemos un arma contra la muerte de los niños que se llama la vacuna para COVID-19. Entonces mi recomendación es, por favor, vacúnense. So my plea to all the parents in our community here in Hartford, throughout Connecticut, is please get your kids vaccinated. This is one of the best things you could have done probably in the history of the children that you're going to be taking care of. You do it for measles, you do it for mumps, you do it for rubella, you do it for chickenpox, for tetanus, you do it for meningitis. And this vaccine is going to be effective just like those. Entonces, por favor, a las familias, hay que vacunarse. Ustedes, los padres, tienen que vacunarse y los niños deben vacunarse para evitar este virus que ha sido tan tremendo para todos nosotros. Lastly, the vaccine will do one other thing. It will allow the kids to get together, get back to normal, and hopefully begin to curb the issues that we have with mental health in our communities. La vacuna también va a evitar, va a permitir que sus hijos vuelvan a una vida normal y va a disminuir ese problema de enfermedad mental que tenemos hoy en día en los adolescentes y en los jóvenes. Entonces es un mensaje de optimismo para todos ustedes. Pregúntenos, por favor, cuáles son los efectos. Yo les puedo contestar, lo conozco. Mis hijos están vacunados, ya son mayores. Please ask about the questions, what are your concerns? Please ask from Connecticut Children's. We will provide the information for you, and please get vaccinated. So thank you, Senators, Mayor, and for the Hispanic Health Council for what you're doing. Para ustedes, los trabajadores, muchas gracias. Muchas gracias por lo que hacen todos los días, por batallar diariamente en ir a cada casa, a cada comunidad y vacunar a las familias de Hartford que lo necesitan tanto. Thank you again. Thank you very much.
Acaba de hablar el doctor Juan Salazar, quien es el director médico jefe del Hospital de los Niños.
Senator, we spoke a little bit about social media platforms being more effective at squashing misinformation. Do you have any way to quantify that? Yeah, I'll give you the number. I don't have the numbers in front of me, but there's a recent study showing that social media companies are twice as likely to take down misinformation and flag misinformation on English language sites as they do on Spanish language sites. And that's a real concern. It's something I think Senator Blumenthal and I will be looking into. It's obviously a decision that the social media companies have made to spend more time investigating misinformation on English language sites than on Spanish language sites, despite the fact that folks who are primarily Spanish speakers aren't spending any less time online than Americans who are primarily English speakers. So there's a good recent study out that I'll be happy to send you.
This is a problem. As you know, we've highlighted it in some of the hearings that we've had relating to Facebook, Snapchat, YouTube, TikTok. It's not just one company, it is many, and it's not just Spanish, it is other foreign languages as well. And it's not just medical information, it's
a todos los que están ahorita conectados con nosotros, si tienen alguna pregunta, pueden aprovechar y nosotros se las hacemos llegar a cualquiera de los funcionarios que se encuentran con nosotros ahorita. Recuerden, está ahorita hablando el senador Richard Blumenthal, está el senador Chris Murphy, está el doctor Juan Salazar, director del Hospital de los Niños de Hartford, y también está el CEO del Concilio Hispano de la Salud. Aprovechemos este momento para que le hagamos las preguntas de los padres de familia que aún tienen dudas.
This may be a question for Dr. Salazar or Ken. Among the families who do want to get vaccinated, who have already decided that they do want to get their children vaccinated, what situations or barriers can those families still face in actually, getting through the pathway of getting their child vaccinated? Among either the families that you serve or that come here, what other things still might they need help with to actually get their kids vaccinated?
Yeah, that's a great question. So one of the things we're doing at Connecticut Children's is that we have a list of all the kids, all the families that have children with underlying conditions, about 3,000 in this age group, 5 to 11. So immediately upon the approval of the vaccine for this age group, we actually sent an email to all of them And very quickly, they registered. So one of the things is you got to bring the vaccines to the families, remind them, and provide a venue where they can actually come in and get vaccinated. But I do understand it's not always easy, right? If the family's working, they don't have transportation, how do they get to the right place? So at some point, we actually do have to partner with the Hispanic Health Council and actually bring the vaccines to the kids so that it makes it easier. One of the things we're going to do is with the event at Dunkin' Donut Park, which is going to be widely publicized. People will come in on a Sunday. People generally not working on that Sunday. From 10 a.m. to 4 p.m., they can walk in without a prior registration, and if they have a 5 to 11-year-old, we'll vaccinate them on that date. What you do, obviously, the community health workers, going out there and linking people to the vaccines. If you have a website, I know everyone has a phone. Most people have a phone. Just go into the Department of Public Health website, put in your zip code. I did it just before coming here, and for children 5 to 11, and there were at least 7 different sites within a 2-3 mile radius where you can actually get vaccinated. So that's something we can do. Ken, I don't know if you want to provide other information.
Doctor Salazar, antes de que se nos vaya, estamos completamente en vivo para City en vivo. Tenemos pregunta de alguien de la audiencia y dice, en caso tal de que los efectos secundarios de la vacuna sean diferentes a los conocidos, ¿qué se debe hacer?
Bueno, si su hijo o su hija reciben la vacuna y tienen algún efecto que no entiendan, de pronto tienen fiebre muy alta o están muy decaídos o algo les está ocurriendo, por favor llámenos a Connecticut Children's o llamen a su pediatra para poderles explicar qué es lo que tienen que hacer. La buena noticia es de que en el estudio que se hizo, la mayoría de los niños, 99.9% de los niños no tuvieron ningún efecto secundario mínimo, solamente el dolor en el brazo, de pronto un poco de decaimiento, febrícula, que pasó en 2 a 3 días. Los niños toleran esta vacuna mucho más que los adultos. Entonces, eso es algo bastante bueno. Los niños generalmente son mucho más fuertes que los adultos, eso lo sabemos desde hace mucho tiempo.
Gracias. El doctor Salazar da un parte de tranquilidad también para los efectos secundarios de la vacuna en los niños.
The people we work with experience are just general access to care, number one. Number two, there are language and cultural barriers that they experience. And then also just access to accurate information. So it's our job to reach out to the community where they live as much as we can and as an effective way as we can to make sure that they're receiving information in a culturally competent way. They're receiving, they're being directed to the sources that are out there, and that it's done in a way that is compassionate and is sensitive to the unique situation they may be in. And when I say that, keep in mind, a lot of the folks that we work with, vaccinations may be one of the last things that they're concerned about. They're just worried about some of the basics that you're trying to address through the some of the legislation you're working on. They're just trying to figure out how to eat, how to live, you know, get a shelter over their head. So we have to address these issues on a very holistic level. So I hope that answers your question.
Dr. Salazar, real quick, you mentioned a child, I think last week, was intubated with, how old was this?
Yeah, for confidential reasons, I really can't tell you, but it was a pediatric age group. And unfortunately, the child is doing better right now. And, but again, it just highlights that we're not out of this yet. You know, even though Connecticut is doing better than perhaps every other state in the union, and I'm very proud to be able to say that, the risk is still out there. You know, we still have 300 or 400 cases a day here in Connecticut, and children are being affected. And the children are highly susceptible because they're not vaccinated. So we need to begin to change that dynamic by vaccinating. So thank you for that question.
And children's is dealing with not just the physical issues of this pandemic, but also the psychological impacts. It is overburdened. Its emergency room, its ICU is overburdened with cases of trauma, of mental health, emotional issues. And I think we forget or we neglect the emotional impact of this pandemic, the trauma that's it's inflicted on all age groups, but most particularly on the 5 to 11-year-old who can't articulate it. And the language barriers of our Latino friends may also present obstacles when they encounter this kind of issue. So I think that the focus on this age group in the Hispanic, Spanish-speaking population, as well as all underrepresented groups, is very much an issue, and children is dealing with overflow of mental health and emotional, behavioral issues, and we've highlighted it because of the disparities in the federal formula of funding for children's hospitals as opposed to other hospitals, and working on trying to correct it. But, you know, a very large proportion of American families are one paycheck away from bankruptcy. They're one paycheck away from economic disaster, and the biggest cause of
en
bankruptcy
esta conferencia de prensa, desde el 1.75 de la Main Street nos despedimos. Nos vemos más adelante. Estén siempre allí conectados con nosotros en horas de la tarde. Vamos a estar también conectándonos otra vez para saber y decirles, contarles mejor lo que pueden hacer este fin de semana aquí en Connecticut. Que tengan un feliz viernes y nos vemos más tarde.